Well, through the dementia demonstrator site there was a number of initiatives started up in North Lanarkshire Council area, one of which was the dementia cafes, which have been a real success in each of the local townships in North Lanarkshire. This provides a vital support for carers and also provides some peer support for people who are living with dementia in terms of being able to talk and discuss problems that they experience when living with the condition.
That park is it's just out of this world. I don't think there's another place like that. Things couldn't be better for Julie and I. We couldn't have any more things offered to us, you know what I mean? They've made life bearable for me and Julie. In fact, it's good, we have a good life. Julie and I smile more than we cry, you know, we do, believe it or not. We're two happy people, you know. She knows when she goes there, she's going to have a right good laugh, you know, and a good giggle. But that's who put me in touch with all the services. It's NHS Scotland.
Basically what a dementia champion's trying to achieve is to promote good care in hospital for people with dementia, and it had been recognised previously that people were coming into hospital, they weren't being cared for appropriately, which resulted in poor outcomes. We've also tried to promote the use of the Getting to Know Me tool, which again helps person-centred care, and it's what the patient likes and dislikes, and it helps us to prevent stressful situations. It has been recognised that when people come into hospital, often they're moved 2 or 3 times. We're trying to prevent that for patients with dementia.
The idea is that by identifying frailty early in the pathway of the patient's journey, we can get the patient to the right place at the right time. Early detection of delirium is really important in the management of this often catastrophic illness. Our acute care of the elderly nurses are vital in the early detection of this. Using the standardised tool, the time bundle, developed in association with Health Improvement Scotland, we're beginning to implement this in our acute receiving wards and in other ward areas throughout NHS Lanarkshire. And by doing that, the outcomes of patients are improved.
NHS Lanarkshire about 3 years ago embarked on working through our dementia-friendly design. There was about 5 or 6 of the nursing team attended a training through at Stirling University at the Dementia Centre there, and we undertook the training so that we could come back and have the biggest impact possible by starting to improve the design, the colour, the contrast, the activity, the therapeutic stimuli that was happening across all our wards. We have noticed a reduction in slips, trips, falls. The distress of patients has reduced quite significantly, where they were becoming quite agitated at times because they were wanting to leave the building and not sure how to get out. So we changed all the colour schemes to make any clinical area where patients would be has got specific colours and contrast with it, and areas that's not relevant for the patients to be in, they're very neutral colours, so they're not attracted to these doors or wanting to go into an environment that wouldn't be particularly safe for them to be in at that particular time.
People living with dementia in the local community in Motherwell have also fed back to us that they've noticed differences in the way that people interact with them when they go into their shop, the assistance that's provided to people living with dementia, for example, in trying to find their change or to use their money, has been a real eye-opener for us and a real positive aspect of this project.